Hi, my name's Abby Gruver, and I'm a student nurse at Cedar Crest College. The research article that I was assigned was based on spirituality in the nursing profession, entitled Spirituality and Spiritual Caring, Nurses' Perspectives and Practice in Palliative and Acute Care Environments. The researchers included were Susan Ronaldson, Lillian Hayes, Christina Agar, Jennifer Green, and Michelle Carey. Research problem and significance to nursing. The problem, which is significantly relative to the nursing profession, is that spiritual caring has long been identified as a difficult area for nurses to articulate due to the nebulous nature of spirituality and to a general lack of language to define spirituality in nursing and to describe spiritual caring. Due to this, the study was timely and significant. The culture of the environment in which nurses work may also influence their practice of spiritual caring. The overall intended outcome of this study and purpose was to raise the profile of spiritual caring by nurses. This study was done to help add a conceptual understanding of spirituality and spiritual caring in nursing by analyzing these concepts through nurses' knowing, particularly experience and knowledge. The three aims of the study. The first one was to identify and compare spiritual caring practice by palliative care and acute care RNs. The second one was to determine any correlation between palliative care and acute care RNs, spiritual perspective, and spiritual caring. And the third aim of this study was to investigate perceived barriers to spiritual caring by the two different RN groups. There were 6 different research questions used in order to conduct the aim of this study. The first one being, do perspectives of spirituality differ between palliative and acute care RNs? The second being, do RNs practice spiritual caring in palliative and acute care environments? The third question being, does spiritual caring practice differ between these two groups of RNs? The fourth research question being, do RNs' perspectives of spirituality influence their practice of spiritual caring? The fifth question being, what barriers to spiritual caring are experienced by RNs in palliative and acute care environments? And the sixth research question was, do RNs' spiritual perspectives and spiritual caring practice influence barriers to such caring? As for the framework and model, there was no particular theory or framework used for this study, but overall the study does help to contribute to the knowledge of nurses and their understanding of spiritual caring towards their patients. For the variables and interventions, the independent variable identified in the study was the setting and work environment of the RNs, whether that be palliative or acute care RN settings. This could have an influence on their spiritual perspective and care. The dependent variable is the RNs, whether that be palliative or acute, spiritual caring, and their spiritual perspective. This variable and their perspective on spirituality is dependent on the environment in which they work in. No specific intervention was used for this study. The overall purpose of this study was simply just to compare palliative and acute care RN's spiritual perspectives with their respective impacts on spiritual caring in order to identify the differences between these groups that may assist in understanding the practice of spiritual caring within the nursing profession. This comparison will then allow researchers to identify the differences in terms of nurses' workload and work timeframes that could play a role in spirituality and spiritual care in the nursing profession. As for the sample, the setting of the sample was in Sydney, Australia, with 7 inner metropolitan health services. There were 42 palliative care RNs that were conducted and participated in this study from 1 community palliative care service and 3 hospice centers. As for the acute care RNs, there were 50 participants from 3 major acute care hospitals in Sydney, Australia. They all completed a research questionnaire when they participated, and the data was collected over a 6-month period and interpreted with both descriptive and analytical statistics. Inclusions and exclusion data. The acute care RNs focused on general surgery, orthopedic, and also medical and coronary acute care units. They were identified for inclusion in the study by consultation with the Director of Nursing Services of each of the participating healthcare facilities. RNs working in high-dependency units and acute care facilities were invited to participate, but none were recruited for the study. The palliative care RNs were recruited from hospice centers, specifically 3, and community palliative care services and centers. As for the ethical components of the study, contact was made with the Director of Nursing Services to discuss the research and obtain their consent for their nursing staff in order to participate in the research study. The researchers then asked them for guidance on how to proceed with the research in their facility, in particular, how to advertise the study and get participants for the study. Ethics approval was then obtained from Institutional Ethics Committee prior to the commencement of the study. For data collection, they used a cross-sectional design, and the 2 validated tools and a demographic survey were used to collect the data. The self-completed questionnaire was a socio-demographic survey, including age, employment history, gender, basic qualifications, graduate education in their specialty, and their cultural background being English speaking or non-English speaking. As for the tools, the spiritual perspective scale was used, which measures a person's view on the extent to which they consider that spirituality has an impact on their life and their engagement in interactions or activities spiritually related. This was a 10-item tool using the Likert scale with numbers of 1 through 6 for each item and descriptive words for each number. The second tool used was the Spiritual Care Practice Questionnaire, which measures frequency of assessment and interventions related to spiritual practice and barriers to providing spiritual care. The results of the study. Palliative care RN's spiritual perspective and spiritual caring practice were higher than the acute care RNs. The palliative care RNs were older and also more experienced than acute care. They were in the specialty area for much longer and also found they were further along in their career path versus the acute care RNs. The acute care RNs may benefit from additional support for their spiritual caring. The barriers identified for spiritual caring were insufficient time and patient privacy. The results concluded that the palliative care environment in which end-of-life care is given is conducive to providing spiritual caring. The research raises the profile of spiritual caring by adding some clarity for palliative and acute care RNs and their working environment. The main recommendation of the study was to increase the RN spiritual awareness and spiritual caring and to overcome the spiritual caring barriers identified, which can be done by spiritual self-awareness and growth, and also education, which needs to be reinforced by ongoing programs. Also recommended was that the acute care environment nurses are provided with spiritual caring education specific to that environment. Also mentioned is the use of nurse spiritual caring mentors. Limitations. The RNs were recruited from a targeted number of acute care environments to limit the diversity of acute care nursing specialties. This limitation may have impacted the results obtained. However, the RNs from acute care environments in large tertiary hospitals in a major capital city. In conclusion, the proposed outcome of this research study was to raise the profile of spiritual caring by palliative and acute care RNs through recognition of their spiritual perspectives and spiritual caring practice and the identification of the perceived barriers to spiritual caring in their nursing profession. Through this profile raising, they believe that this is an important element of holistic nursing will be understood and appreciated further, and in turn, its practice enhanced in a range of clinical environments. So my reference is located on this PowerPoint, and I look forward to your feedback and also any questions that you have.